same matters, and how shall we prevent them from continuously happening? My guest this morning is coming in from the Ministry of Health in Uganda, and he's a senior medical officer from the same ministry. This is none other than Dr. Alan Kasozi. A very good morning, Doctor. Many
Yes, certainly teenage pregnancy is a big problem in the country, and lately we are seeing a surge in the numbers of teenage pregnancies all across the country. And especially as we get out of the COVID period, and there is a big risk for us to lose on the gains that we have made over the years as regards teenage pregnancies. Perhaps we need to define what teenage pregnancy is. Teenage pregnancy is a pregnancy by a girl before the age of, anywhere from the ages of 15 to 19. And of course it comes with a lot of consequences, and yeah, it's a serious problem in the country, as we shall see later.
Okay. And trying to understand more of the teenage pregnancy, you get to realize that these are cases that we do not wish for anyone, really, because having a child who is still in school and then, of course, seeing them pregnant as a parent or as a guardian, you wouldn't be happy. And, well, when you look at this situation in Africa, how prevalent are these cases on the continent, before we even bring it to the Ugandan perspective?
Well, thank you for that question. When you look, first of all, globally,
okay,
the rates of teenage pregnancy is 13% on average globally. So that means it's not only a problem here in Uganda, but all across the world. But coming back to Africa, there's regional variations with the lowest rates occurring in Northern Africa at about 9.2%. And then coming more locally to East Africa, we are seeing an increasing trend, which is at about an average of about 21%. However, what's quite damning is that for us as Uganda, we are somewhat above the average, and we are talking about a rate of 24%. 24% essentially means 1 in 4 girls from the ages of 15 to 19 actually gets pregnant. And this is a time they're supposed to be in school. This is a time they're supposed to be chasing their dreams and the like. So it does not make for a very good reading. Yeah.
Okay. And just to also get you through into context, when you look at the stages, there are some health concerns, and some of these some of the things that you wouldn't wish for many to look through. When you look at the adolescence stage, for example, preparing for lifelong health and wellness in such a stage is not an easy thing, especially for a child who is actually crossing into a new phase of their, of their body changes and the same. And investments in adolescent health and well-being bring up a triple dividend for adolescents now. In the near future, you realize that the health ministry is trying to prepare for lifelong health and wellness of the young ones. And the hindrances of this kind of health and long life, teenage pregnancy is one of those. And Dr. Kasozi, I would wish to know, or my viewer this morning would also wish to know, what are some of the impacts that teenage pregnancy has to the body and the mind of a young girl?
Yes. Well, teenage pregnancy in itself is one of the worst things that can happen to a young girl. The fact of the matter is that these girls are not yet ready. both emotionally and physically, to have a baby. They are children themselves, and that says a lot about what their capacity is in taking care of children, if they're to beget other children. So, like we've said, their bodies are not yet ready. They're still in a phase of development, and so are their brains. So, when we talk about physical consequences, we're looking at poor health outcomes, both for the child, the baby, and the mother. And we are increasingly seeing things like obstructed labor amongst young mothers. And with obstructed labor comes things like fistula. I'll let you know that the current prevalence rate of fistula amongst young mothers below the age of 20 is about 6.8%. Fistula essentially means that either fecal content or urine comes out of that individual in other openings other than what was naturally prescribed. And as such, it comes with lots of stigma and hygiene issues. But not only that, teenage pregnancies, because most of them are unintended, we know that sometimes our young mothers seek out for unsafe and criminal abortions, which is not a very good thing. It has its, of course, it has its attendant consequences as well, like pregnancy-related infections, things like bleeding, excessive bleeding during childbirth as well, prolonged labors, and sometimes death, which really is the worst case scenario. But away from the physical consequences to the young girls, we have social consequences. We very well know that our cultural way will most likely ostracize a young girl who is pregnant. And this girl will also have to drop out of school very often. And studies, the current ongoing studies show that a pregnant teenager is most likely going to get pregnant again in the next 1 or 2 years. Due in part because they get married off, or the risks continue affecting their lives. And as such, they end up getting pregnant again. So the consequences are really too many, and we need to act. We need to act.
Well, and according to UNICEF reporting as of August 2023, just to take you back a little bit more, 25% is the rate at which Uganda's pregnancy rates is standing. And we have the highest rate in sub-Saharan Africa. Because the prevalence of teenage pregnancy is very variable, it does range from 2.3 to 19.2% in South Africa, and then 31% in Kenya, 20.4% in Ethiopia, and 31% in Sudan. Now, looking at the 25% in Uganda, it does put us at not a good kind of place to be as a nation that is trying as much to empower the girl child, and also to set a very good kind of example to the rest of other nations in regards to seeing women empowerment as a key objective to the growth of the economy and the development of society. Doctor, looking at some of the, the impacts you've actually highlighted, what do you think has been the cause of these increasing cases of teenage pregnancy? What are the things we're not doing right as a nation?
Well, if you ask me about the cause of these teenage pregnancies, I'll tell you that there's only one cause, and that cause is our young girls and boys are having intercourse. That's the cause. But to be more specific,
biologically, that is the cause.
Yes, we need to look at the risk factors and kind of zoom in and ask ourselves what is making these young people more at risk of teenage pregnancies. But perhaps even before we go there, just a correction.
Okay.
The current statistics released by UBOS indicate that the rate has slightly changed from 25% to 24%.
Just slightly by a percent.
For the 7 years, by 7 years, by the period of 7 years before this statistic was released. And that means that we've made very little progress as a country.
Indeed, because the UNICEF reported 25 was just in August last year. So that means it's simply 7 months or close to 6 months of a change.
Yeah, so 1%, we agree that it's not a very big progress. But that also shows that we need to should I say double or triple our efforts. I believe we shall be talking to that later. So back to the question of what are the risk factors?
And what are the causes here?
Yes, the risk factors are quite many. And they range from we have our community gatekeepers, we have our parents, we have cultural leaders, we have religious leaders. These, we call them community gatekeepers. First and foremost, these are the people who stay with the young children, with the girls in their homes, in the communities, and that's where the problem is. It's where it starts. So we are increasingly seeing a breakdown in the moral ethic of the society. Parents, we as parents, by the way, I'm a father to a young girl as well. We are not doing enough. We need to start having the difficult conversations with the girls, and of course the boys, because the boys are the main culprits in this. We need to empower them with life skills. We need to empower them with information, to understand their bodies, to be self-aware. We need to provide for them. Another risk factor, like you've asked, what are the risk factors? Another risk factor is poverty. I believe you've heard of what's called period poverty. In some instances, research has found that these young girls could actually get pregnant over a lack of basic needs, like food, for example, or maybe even a pad, okay?
Yes.
And yet these are very, very essential for their well-being. So sometimes we might not blame them, we might not point fingers at them, but it's for lack of options. The other issues really is about a lack of information generally, either information at school or in the communities. We need to give these young people information, the requisite information they need to deal with the day-to-day challenges of life, to negotiate in life, to be assertive, to understand that staying in school and chasing your dreams is protective, is not only protective for you as a young person, but also it is empowering, because once you are knowledgeable, then you have power. And that the story of your life is in your hands to chart. So knowledge is very important. Information is very important for these young people, and they lack information. They need vocational skills, just away from just the life skills. They need vocational skills to be empowered and to make a living and get some purpose out of their lives as well. So for any of the young people out there, if it's your vacation, if you're in your vacation, S4, S6 vacation, or if you're already out of school, find something to do. Because if you're idle, the common saying is that an idle mind is Is the devil's workshop.
eh.
Yeah, so you need to have something to do to keep busy. Yeah, so lack of any of those creates a big vacuum in the lives of these young people and increases the risk for them to actually get pregnant.
Okay. And of course, when you look at some of these issues, you've mentioned something very critical, discussing or having open-minded conversations about sex education as a very critical point in today's world. When you look at most of the parents, they're actually having an issue, or most of the parents are too shy, for lack of a better word, to open up to their children about the effects and of this. And yet they know that their children already have ideas about what is happening.
Yes, I talked about having the tough conversations with our children. Why? Because in as much as government has done their best, we know that there exists a Penal Code Act in place, prescribes punishments and what needs to be done in case a young girl is abused or a young boy. We have a raft of policies and guidelines at the Ministry of Education, Ministry of Gender, Ministry of Health. All these speak against abusing children, sexual violence. And there's a whole range of interventions against protecting these young girls and boys against teenage pregnancies. But the big but is what is not being done. These young girls are getting pregnant in the communities, and who is getting them pregnant? It's the people nearest to them, their peers, their relatives, and their caretakers in some instances. So we need to ask a question. Who is going to give this information? We know very well that young people exist in about 4 spaces. Young people exist in the community, and in the community we have homes, okay? We know that these young people exist in schools, and we also know that they come to our health facilities. But not only that, increasingly with advances in technology, young people are there on social media. So they are digital platforms. So as we give them information, we need to find them in all these spaces. But most importantly, the biggest voice is the voice of the parent. Is the voice of the parent, because the parent is the first caretaker, is the first refuge for this young person. So as parents, we need to be quite intent on providing information to our young people, and we need to ensure that this information is done in an age-appropriate way.
Okay, because that is where I was coming in. Most of the parents are really scared of starting up these conversations. Why? They don't know whether the kind of language they are going to use may sound obscene to a given age bracket of their children, but they are seeing how the bodies of their children are changing and how they are reacting towards certain topics. How do they come up with these conversations? You know, from a health worker's point of view.
Yes.
How would, and you're a father, by the way, how do you think someone can easily come up with these conversations? Talking to a teenager who is, you know, pretty much experiencing adolescence. Okay.
Yeah. So it's true. Sometimes you cannot give what you don't have. The capacity of our parents sometimes also needs to be built to be able to provide this information to the young children. But we are all aware that our cultures mean no harm. Ugandan cultures are quite diverse, and every culture, if you took a keen interest, has some form of way that they raise their children, or they encourage parents to provide this information to their children in an age-appropriate way. And this information actually starts right from birth. And should I say it's lifelong, because learning never ends. So if I could just give an example, just to give it a bit of context. If you had a toddler maybe like 3 years, it would be important for them to know about hygiene, that it's not good to maybe ease yourself in the open. It would be important for them to know about friendship, healthy relationships and friendships.
Platonic relationships.
Yes, how to be a good friend, for example. It would be important for in the formative years for a child, say, to know how to respect their parents and how to respond to requests from their parents. As they get older, we teach them good behavior and character formation, about the love for God and respect for God. And these lessons we keep stepwise, we keep adding on more and more information according to how they're developing. As they reach adolescence, let's say for a 10-year-old, it would be important for you to prepare them for the body changes that are going to happen. So you could perhaps like have a conversation with a young girl and tell her about the expected body changes. So much so that if she woke up and found a patch of blood on her bed sheets, or if her skirt is soiled, then she would know who to approach and what to do, okay? Not only that, that we should give them information, but also us as caretakers and as parents, we need to be prepared to know what is next, because body changes occur, physical changes occur, and emotional changes occur, okay? So we need to know, we need to be on top of our game and to know what is next, what we should expect, so that we are also not surprised by what's happening.
On the matter of the surprise on what is happening, I have some views and comments coming in from the viewers, but that will be our starting point after the break. Why? Because I need us to look at what needs to be done to address holistically, what needs to be done to be so as to address this vice, and then also from the Ministry of Health, because at least this is to help the people understand that the Ministry of Health is having different initiatives and programs to ensure that such things, are more than just talked about, but also going practical in regards to putting an end to teenage pregnancies in the country. That and more is what we are going to be discussing after the break. Meanwhile, stick around with us here on Good Morning Uganda Extra. More is yet to come as we discuss teenage pregnancies and how to deal with the uprising cases.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Have you packed more with Harbour jelly and Harbour foam?
Yes, we packed.
It will protect your skin from skin rashes.
Morbid pack.
It is a new improved Morbid Harbour jelly. So soft and smooth.
It is a Morbid Harbour jelly.
Tell me, kids, the scent. Any irritations? No more rashes and irritations. Movit Harbour Jelly and Harbour Soap is rich in natural herbs for a smooth and glowing skin.
Movit all day confidence.
Juko.
Yo.
Check the shopping man. What's your secret?
Uganda wange, haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
UBC is the national public broadcaster. We educate, inform, entertain, and inspire our audiences. You can watch us on free-to-air channel 001, DSTV channel 282, GoTV channel 371, Star Times channel 201, Zuku TV channel 20, and Azam TV channel 350. Even when your subscription expires, you can still watch UBC for free on your pay TV platforms.
Welcome to Dade Nazarene Primary School, Luzira, a school that gives your child a positive learning environment that makes them feel comfortable and safe. We are a progressive year-round Nazarene Primary School, providing a child-centered approach to early learning, collaborative family atmosphere, and a safe, inspiring environment that encourages exploration and creativity. Dade Nazarene Primary School offers a wide range of co-curricular activities that promote teamwork, physical and mental development, including ballet, soccer, basketball, piano, and home economics. Admissions are in progress from baby class to P7, starting from the 8th of January to the 5th of February 2024. Find us at the first left turn after Oryx Service Station towards Luzira.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.
We'll be back from the break, and we are continuing with our conversation of teenage pregnancies in Uganda. It's not something that brings out excitement as you're talking about it, because the mere fact that it is pregnancy, but again, talking about teenagers carrying these pregnancies. Surprisingly, by the way, when you look at it, the cases of teenage pregnancies are coming in widely from far to rich areas. I'm not ruling out the fact that even in towns, these cases are available, but you realize when you go deep in villages, when you go to societies that are still upholding these cultures of granting parents, the chance to marry off their daughters as early as 14, 15, 16. This puts these young ones at risk of so many health complications, just like the doctor did mention here as we were starting up with our conversation. This is a vice that we want to put an end to. And the reason as to why the government also put in place the UACE and UPE education was in order to ensure that the girl child goes to school. And the Ministry of Education has furthermore been pushing for initiatives, and we've seen NGOs coming together to ensure that girls stay in school. And for the parents who are not able to afford school, that is where the government came in with the universal secondary education and universal primary education to ensure that at least they can afford education, but seeing that children are going in school. Because a society that is breeding learned people is quite different from a society that is, breeding the illiterates. And I'm not attacking anyone with my choice of words. But as we are looking into this topic that is rather sensitive, we need to come up with solutions. We need to come up with, with opinions and views that are practical, not only paper-centered views. I'm still with Dr. Kasozi here from the Ministry of Health as we are discussing matters to deal with teenage pregnancies. Doctor, looking at what you've put before the break, what parents need to do, the other concern goes to what can society do to address these issues? Because as the child is growing up, at times the parents are overwhelmed. And it's something that they do not do deliberately, but they are overwhelmed with the pressures of society. And again, you get to realize that society finds itself grooming this child for you. Now, the sad part is society may groom your child well or completely destroy their future. What can society do, and what can members of society do to address these cases of teenage pregnancy?
Yes, thank you very much. Again, you'll excuse me, I've put a lot of emphasis on the parents.
Okay.
Because over time, so much has been done, and indeed is already is continually being done. And what we have seen and noted is that at the core of society, the most basic unit, which is the family, that's where everything is going wrong. But to answer your question on what else can society do, you remember we talked about the spaces where we find these children, these young girls and boys. The next bit there is school. Children in adolescence, of course, are expected to be in school, and when they are in school, up to about 75% of their time is spent there. So what already is being done is our colleagues in the Ministry of Education, who have the mandate over the schools, launched what we call the National Sexuality Education Framework in 2018. And this is a very beautiful document that gives guidance on how sexuality education is conducted in schools. And indeed, there's some bit of sexuality education being conducted in schools. If you're a very ardent listener, you probably have heard about MDD campaigns, music, dance and drama campaigns against teenage pregnancies in schools, school debates, recreation activities where schools integrate messaging against teenage pregnancies in recreational extracurricular activities, as well as the other programs like PSA, the presidential initiative on against AIDS strategy, and other initiatives in schools. So this is being done. Perhaps we need to ask ourselves, how can we add more fire, or how can we triple or even quadruple our efforts to see to it that every learner gets this information in an age-appropriate way. Okay. We know that there could still be a bit of challenges here and there in some schools, especially regarding human resource, regarding professional counselors and school nurses. But the ministries of education, gender and health are not sitting. We are doing what we call task sharing, and where we could be challenged with human resource, actually we are giving this task to the senior men and senior women teachers. There is quite an investment in the recent years. There is quite a considerable investment that has gone into training the senior men, senior women, as well as the school administrators in appreciating the need for this information in schools. And indeed, this information is already being given. Away from the schools, we have our community leaders, we have cultural leaders and religious leaders. We are working together with the Ministry of Gender, because as you can see, teenage pregnancies, it needs a multi-pronged approach. It's not only a health problem. It doesn't only belong to the health sector as a challenge, but it has its feet also in gender. It has its feet in education, in local government. So we're engaging constantly with our colleagues in the Ministry of Gender to see to it how this messaging against teenage pregnancy can reach our adolescents through the religious leaders, first and foremost, as well as the cultural leaders. Earlier on, you talked about the young girls getting married off to maybe older adults. And here the question would be, who is presiding over these marriages, you know? So
which cultural practices still push for this?
Yes, the cultural practices, but even in some instances, you could find, I'm not being judgmental here, but we've had some cases where a few individuals have presided over the marriage of underage children. Those scattered are not many, but we cannot deny the fact that it has happened. So we need to have these conversations. And indeed, we are having these conversations in the communities, with the religious leaders, and as well as with the cultural leaders.
Well, getting through some of the comments coming through this morning, I do have this one saying, good morning, Extra. I think my approach will be putting all efforts to the boys because I'm a man. The problem is not them, rather than men or boys. We are so persuasive. Given that we are a race of hunters, a hunter will do what it takes to find the prey. But a young prey is not a good one as well. Deeper, what influences us to get the prey is why we get the prey at any cost. Thank you for the show. I'm Bruno, leader Victorious Nation Luzira. This one is Bruno saying. Then he says that the other thing I am to push is to stop the business of free condoms and increase the price of the condoms, because when you look at it, it promotes prostitution, which cannot give satisfaction, as need rather hunting innocent girls. Now, on the issue of government supplying the condoms, this is literally something to do with a preventive measure for many things, not only teenage pregnancy. When you look at it, Bruno, because it looks at also sickness or sexually transmitted diseases, and also pregnancies as well. And then when we talk about opening up to the children, these are some of the things you also open up to them in the conversations. But many thanks for that view. This one says, GMU, in my point of view, most of the teenage pregnancies are as a result of school dropouts. Make quality education affordable for all and let the girls stay in school. Cattle can easily be managed on a paddock system than in a free-range scale of grazing. I'm Demas. I love the choice of words there, Demas. Many thanks for your point of view. And then, good morning. This is Bernard Onen. The day when those who wish to repeat senior for this year, well, I'll be giving you more details of the same. Bernard, currently we are discussing matters teenage pregnancy, but many thanks for watching and joining our conversation. Doctor, let's get to the Ministry of Health. What does the Ministry of Health have in plan, or what has the Ministry of Health been doing in order to reduce these cases of teenage pregnancy, and what lays ahead in regards to these strategies that they are laying on board?
Yes, thank you very much, and allow me to thank the contributors, our online contributors, for their opinions. Perhaps before I can answer your question, okay. There was a question on, I think, condom distribution, which you ably answered, but also about the other contributions on keeping the girl child in school. In school, yes. They were quite philosophical.
He used the
analogy of paddocking, yes. Yeah, that was wonderful. As well as, I think, the second one was about provision of quality education, which still speaks to keeping the children in school. Yeah, so, like I said, the issue of teenage pregnancy is multi-pronged. If we're to tackle it, we have to use a multi-pronged approach. And each sector really has something to bite off when it comes to tackling this big issue, this big elephant. So broadly, for us as the Ministry of Health, whatever interventions we put in place is mainly preventive. And preventive, we're looking at a provision of information as well as providing a good or conducive policy legal environment against teenage pregnancy. I'll get into the details later. But not only that, once these girls are pregnant, then it's also prudent upon us to provide a safe motherhood package for them so that we can get the best possible outcomes for both the mother and the child. Back to the policy legal environment at the Ministry of Health, we recognized adolescents as a very special interest group, and as such, the ministry actually even created a whole division, can you imagine, a whole division for the health and well-being of adolescents and young people all across the country. And this division's mandate really is, what we are doing currently is, we've come up with a raft of policies that guide on the provision of adolescent-friendly and responsive services. The current policy standard and guideline was formulated in 2012 and speaks to one of the key objectives. It speaks to provision of information to these young people as a means of prevention of not only teenage pregnancy but also the other health-related challenges. Things like mental health, nutrition, HIV/AIDS, communicable and non-communicable diseases. The other thing it speaks to is negative social cultural norms. So it comes up with interventions against these social cultural norms and how actually we can identify and manage these social cultural norms. Not only that, currently we've finalized this, what we call the school health standards and guidelines, which shall provide guidance on the provision of adolescent-friendly and responsive services in schools, as of course we await our colleagues in the Ministry of Education to gift us with the school health policy. The guidelines and standards we believe shall suffice. But not only that, that's for the in-school. What happens for the out-of-school? The out-of-school, we are currently in the process of finalizing the quality of care standards and guidelines, and these also provide guidance on how adolescent-friendly services can be provided in the communities and the health facilities. We are doing a lot of capacity building for the service providers on the different platforms. We are doing a lot of capacity building in school, like I said, in collaboration with our colleagues in the Ministry of Education and Gender. So we are teaching senior men and women on how to actually handle these adolescents once they approach them with health concerns, how to communicate. We're equipping them with skills on how to communicate, how to put across health-related information, how to offer counseling and guidance, how to offer interventions around menstrual health and hygiene management for both boys and girls. You wouldn't be surprised, the next generation of learners will actually know how to, like for boys, they know how to make a pad, a disposable pad, where there might be no resources to actually buy a pad. So all this is happening. And in the communities, we are holding dialogues. We're having lots of dialogues with the community gatekeepers, local council governments, all the way from the districts, cities, municipalities, up to village level. When it comes to provision of information, we know that we can't be everywhere as a ministry. So we just yesterday, we are engaging other platforms and stakeholders that can help us actually amplify our voice as a sector to reach to the last mile, to reach these young people on all issues, not only teenage pregnancy, but on all issues, sexual reproductive health, and other health-related concerns. So just yesterday, as I was saying, the Division of Adolescent and School Health held a breakfast meeting with journalists from the major media houses around Kampala, where we passed across the current status. We helped them understand the current status of adolescent health, the challenges and what the ministry is doing, and of course what needs to be done by the different media houses. And in this, we had a call to action for the media houses to help us amplify the adolescent voices, air their voices in using the different platforms available. But not only that, also to report on adolescent-related issues in a non-sensational way. When it comes to disseminating information, the ministry also has what we call the hotline. Unfortunately, we don't have a banner here, but I could maybe just say it, if you could, with your permission, on TV. Our hotline it's a toll-free line. It's free of charge. It's 0800 1000 66. Again, I'll just repeat, 0800 1000 66. It's available online. If you searched up Ministry of Health hotline on the internet, you will get it. And this mainly exists for the sole purpose of providing information to adolescents. We know they're shy. Sometimes they may not want to come to you as a parent, or as a teacher, they might actually fear you. So they need, sometimes they need privacy and confidentiality. So the hotline offers them that opportunity to talk to a service provider, to talk to a health worker in the comfort of their homes. They don't need to come to Kampala or travel to a health facility. They'll get this information through the hotline. We offer counseling and guidance. We offer referrals if they needed a service, as well as follow-up and linkages between service points.
Oh, okay. And Doctor, what would be your parting shots as we're winding up with our conversation this morning?
My parting shots, I would like to thank you very much as a national broadcaster for having me on this talk show.
Pleasure is ours this morning.
And encourage all the major stakeholders to know that we all have a role to play when it comes to ending teenage pregnancy. This is not only a sexual problem. It does not only lie with the Ministry of Health or Education or the Ministry of Gender, but that we all have a role to play. And we must start having the difficult conversations in our homes, because home, the family, is the most basic unit of society, and charity begins from home. So if we can have these conversations from our homes, then we hope that we can be able to change the behavior and attitudes of our young children. The ministry, the government is already doing so much to see to it that we have a healthy and thriving population, not only for the adolescents, but all across the life course.
Okay.
Because it's in the government's interest to realize Vision 2040, to have a healthy and thriving population. And we can only do this by realizing what we call the demographic dividend. We need to see a healthy, well-fed and productive population with less dependency in the future. It's the only way we can achieve prosperity as a country and thrive.
Okay.
So thank you very much once again. And I remind the community gatekeepers, especially the parents, to start having the difficult conversations with their children.
And well, there you have it, Dr. Alan Kasozi, who is a senior medical official or officer from the Ministry of Health. And our topic was looking at the upsurge of teenage pregnancies in Uganda, but just to remind you of the toll-free line that he has actually given, 0800 100 66, 0800 100 66. That is if you want to reach out to the Ministry of Health for any sort of emergency and inquiries. Well, I will end up our show with a comment. This is coming in from this particular one didn't leave the name, but he says government needs to put regulations on alcohol, as we have seen parents give away their teenage girls because someone bought them a drink. Fight corruption at police, because nowadays people are willing to report incidents like early marriage, but culprits give bribes and are released the next day. Government should task the LCs, schools and religious leaders to disperse sexual education. Oh, this is DK from Chegegwa. Many thanks for that particular view and opinion. And this brings us to the end of Good Morning Uganda today, Tuesday, the 27th of February, 2024. From the time we started off from 6:30 a.m. till this hour, with 3 minutes left to 10 a.m. Many thanks for always waking up with us. And for those who join us along the way, you mean a lot to us. And to you, our viewer, we shall be doing this same time tomorrow from 6:30 a.m. here on UBC. But stick around on your national broadcaster, because coming up next, we do have plenary sessions live from Parliament. And that and more is what you will be getting live on your national broadcaster. I'm Jerome Paul Sonko. Have yourselves a blessed day and a good morning.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.
Junko.
Yo.
Check the shopping, man. What's your secret?
Uganda wange, haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Junko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government, designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
UBC is the national public broadcaster. We educate, inform, entertain, and inspire our audiences. You can watch us on free-to-air channel 001, DSTV channel 282, GoTV channel 371, Star Times channel 201, Zuku TV channel 20, and Azam TV channel 350. Even when your subscription expires, you can still watch UBC for free on your pay TV platforms.
Actually, Zono Industrial is one of the presidential initiatives which is brought here in Achule land to skill our youth. The skilling is free of charge. What you really need, you have to be within the age of 18 to 35. They don't need any requirements apart from being willing. You have to be willing, and a youth who is willing to get the skills. The courses we have started with only 4. That is tailoring, hairdressing, carpentry, and welding. First intake, we registered 212 students from 10 administrative units of Acholi. These students, they recruited them from different districts within the Acholi sub-region. If we continue with this cooperation, many beneficiaries will pass through us, and they will require, will go with enough skills, unknown skills, which will change them and later bring them into an economy. We shall really fight poverty in that way.
I am Monsignor Gerard Kalumba, Parish Priest of Christ the King, and the Vicar General also, one of the two Vicar Generals in the Archdiocese of Kampala. We are in the second week, we are finishing the second week of Lent, and we are asking ourselves, what is Lent? What do we celebrate in Lent? In the Catholic Church, we have another word we use, especially locally.